Hello and welcome to Herbal Wellness. Today we're going to be talking about aromatherapy. It's an art and a science and has been used for centuries to improve health and well-being, both physically as well as emotionally. We have many essential oils now in our time that can be used for a myriad of different types of afflictions. Again, as I said, both physical as well as emotional. We have many essential oils here. This is only a brief introduction to aromatherapy. In later informational capsules, we will be talking about each one of these specifically and giving more details. Aromatherapy is an art and a science, as I said. An art because for many centuries, the use of pleasant aromas has been used not only in medicine, but also for political and religious purposes as well. It's been a part of very important rituals and still is in a certain way. Now, many of these essential oils we have to understand that we find in commerce are not exactly very recommendable or recommended for putting on your skin, much less for ingesting them. So we have to understand that the essential oils of good quality are going to be a bit more expensive, but they have to be organic. That means that they have not been exposed to any types of pesticides or other agricultural chemicals or agrochemicals like synthetic fertilizers and so forth. So if the essential oil that you have or ones that you're looking for at the store do not have a certified organic statement, then I would not recommend you to buy them. There are other products that are not essential oils at all, and they're only basically perfumed oils. In other words, these types of oils are not true essential oils. They don't mention they are, they just mention that they are oils to actually improve the aromas and the ambiance, okay, so put in potpourris and so forth. But these products are not true essential oils. You would not want to put them on the skin, not even inhale them for a long time, because they do contain artificial colors, artificial fragrances, and other chemicals that can be very, very noxious to your health. Now, for example, a true essential oil like the one I'm having in my hand, like in this case, it's wintergreen. Wintergreen is a warming essential oil that can be used for musculoskeletal pain. It has slight anti-inflammatory properties as well. It contains compounds that are similar to the ones you find in aspirin. They're called methyl salicylates. So again, if you are allergic to aspirin or you know someone who is, they would not be using this type of the wintergreen oil. But if you're not, this is an excellent oil, again, that can help with muscle pain or arthritic pain. Okay, I'm not saying it's going to cure it. We're not going to mention anything that cures any disease. We're just mentioning these as options you can use in order to improve your health and well-being. Now, as I said, this is important because wintergreen, 90% of the wintergreen you find in commerce today is artificial. It is synthetic. It is not the true wintergreen, and I do not recommend you using it. Okay, it might bring some secondary reactions in the future. Everything that you absorb in your skin will go into your bloodstream. So you've got to be very careful, even with pure essential oils, which ones you use. Okay. Now, in the case, for example, of citrus like bergamot, for example, or sweet orange or lemon, most of the citrus essential oils are uplifting. That is, they can be used as coadjunctive therapy for people who have post-traumatic stress disorder, PTSD, or for people who have depression or anxiety. Okay, they work quite fast. They work quite fast, and in my practice, they really have done a lot for people who have problems of stress and anxiety. In the case, for example, of rosemary oil, depending on the chemotype, and we'll talk about that in later informational capsules. Rosemary is highly antiseptic. Studies have found that not only the plant but the essential oil could be theoretically useful, perhaps in the future, for the treatment of Alzheimer's disease, because it seems that the ingredients in rosemary might actually help with a neurotransmission in patients that have senile dementia. Again, it's only experimental. I am not stating that this is a cure for Alzheimer's at all. All I'm saying is it could be in the future looked upon as an option. We have different types of essential oils that can be used, for example, even as insect repellents. We have different types of eucalyptus, for example. There is a variety of eucalyptus that you can also combine with patchouli, you can combine it with clary sage and other, possibly lemongrass, and make your own spray as a insect repellent. I'm not saying that you're going to put this directly on your skin. You're going to spray it near around you with your eyes closed, obviously. And it might be a safer option that some of these products that you buy at the drugstore that you have to put on directly on your skin that could be toxic or could, have secondary effects in the future, especially with long-term use. There are different essential oils, like, for example, like sweet orange, another citrus. Again, these are very uplifting oils. They have a delicious aroma. And so, there is a relationship between the aroma and the mood that people can be in. When you go into a room and something smells awry, something smells bad, you are usually not in a very good mood. It's uncomfortable to be there. But when you go into a room and that has a diffuser with, different types of essential oils that have a delicious aroma, it really is uplifting, and I think it does affect your mood in a very positive way. Now, I want to make it very clear that essential oils are not cosmetics, okay? Essential oils should be treated with respect, and you should not leave them near pets or near children, okay? Essential oils can sometimes be applied directly on the skin. It's called NEAT, N-E-A-T, NEAT application. However, when you have any doubts, be very careful and always dilute them either in jojoba or jojoba oil or almond oil or their grapeseed oil. There are many, many types of carrier oils that are used to dilute them, okay? When in doubt, always dilute. Some essential oils could have a negative effect if you ingest them. As I said, in some cases you can dilute it in a gel cap. You should never ingest any essential oils without prior approval from a health professional, okay? Some essential oils can be directly toxic, and some of them can be very dangerous if you ingest them for a long time. So remember, first, before you ingest any essential oil, have a certified practitioner talk to you about that and the caveats or the possible noxious effects on your health. Some essential oils should not be applied for a long time on the skin. Remember, things that we apply on the skin will go into the bloodstream as well. They're lipid soluble or fat soluble. So you've got to be very careful as well. Now, again, a good quality essential oil is going to be more expensive than the cheap varieties that are used that might be industrial grade. You must be also very sure that it is from an organic source and not to use them for an extended period of time without having a rest period in between. In any case, we'll be talking more about the art and science of aromatherapy in different capsules in the future. I hope this information was useful to you. Thank you very much.